Hi, I'm Dr. Sharbul Hashul, and today I want to talk about a question I get asked a lot. Do birth control pills increase the risk of breast cancer? It's a fair question, and the honest answer is yes, there's a small increase in risk, but the full picture is more reassuring than it might sound at first. Let's start with what the research actually shows. Combined oral contraceptives, the pills that contain both estrogen and progestin, have been studied for decades. Large studies, including a well-known Danish study following over 1 million women, found that people currently using the pill have a slightly higher relative risk of breast cancer compared to those who never used it. Newer formulations of the pill show a similar small increase. So this isn't just an old pill problem. But here's the important part. Relative risk and absolute risk are two different things. When researchers say the risk is higher, they often mean higher compared to a very small baseline number. In real terms, for most people using birth control pills, this translates to a very small number of additional breast cancer cases per year. To put it in perspective, we're often talking about something like one extra case per several thousand users annually. Breast cancer is already relatively uncommon in the age group that typically uses birth control, mostly people in their 20s, 30s, and 40s. So a small relative increase doesn't translate into a large real-world change for most individuals. Another reassuring point is that this increased risk isn't permanent. Studies show that once someone stops taking the pill, the risk gradually goes back down. And within about 10 years after stopping, it appears to return to about the same level as someone who never took it at all. It's also worth remembering that birth control pills aren't just about preventing pregnancy. They come with real health benefits too. They're linked to a lower long-term risk of ovarian cancer and endometrial cancer, benefits that can last for many years after stopping the pill. Many people also use them to manage heavy periods, painful periods, acne, or conditions like endometriosis. So when we talk about risk, it has to be weighed against these benefits, not looked at in isolation. Individual risk also isn't one size fits all. Things like a strong family history of breast cancer, carrying a known genetic mutation such as BRCA1 or BRCA2, or other personal risk factors can shift how a doctor and patient think through this decision together. This is exactly why birth control choices should be personalized rather than based on a blanket rule. So what's the practical takeaway here? If you're currently using or considering hormonal birth control, don't panic about this small statistical increase, but do bring it up at your next appointment. Ask your doctor to walk through your personal risk factors, your family history, and your reasons for wanting birth control, so you can make a decision that fits your specific situation, not just a headline you read online. Breast cancer risk is influenced by many things working together: age, genetics, lifestyle, reproductive history, and yes, hormonal medications play a role too, but it's one piece of a much bigger picture. As always, this video is meant to give you general evidence-based information, not personal medical advice. If you have questions about your own birth control options or your personal breast cancer risk, please talk with your doctor. They can look at your full health history and help you make the choice that's right for you. Thanks for watching, and I'll see you in the next video.